Good afternoon, everyone. How's everyone doing? Yes, I like the energy. Thank you. So we're going to start with our next session, which is with Women in Tech, about women's health, AI, and the equality moonshot, going everywhere and covering many sectors. So from reactive care to predictive prevention. And I would like to invite Dr. ANGELI MÖLLER, who's the Managing Director of Sequoia Growth GmbH, who's the moderator. Thank you for joining us today.
Great, and I'm going to be really swift in inviting all my panel to come up together. And that relieved several seats, as people who were standing may have suddenly realized. So I really love seeing the crowds in the back, and I know it's not easy to stand and listen to a talk, but I thank you all for being here with us, and so grateful to my esteemed panelists for making time to be here. I know that some of you have flown in from around the world to do this. Truly grateful.
I was sleeping in the plane a few hours ago, so sorry if I'm not looking very fresh.
Look, it's wonderful. It's a global summit, and that's what global really means. So I'd love to introduce, first of all, LAVANYA ISSENMAN. LAVANYA is a behavioral scientist, and she's also the global head of Audiological Care Academy at Sonova. So what does that actually mean? So around the whole globe, both in established and in emerging markets, she is training audiology experts in how to work with patients, and also providing AI training, as well as giving them the latest information on hearing care. LAVANYA's work really centers on scalable technologies, and I think you'll see it as we get into the conversation that I know over the years I've learned a lot from her about how nudges and tweaks can really change the way people behave and respond. So I look forward to that. And then I'm really delighted to introduce Annie. So now you already know that Annie has flown in from India to join us today, and we're truly grateful. Annie is the director and the founder of Light, which is the Laboratory for Intelligent Global Health and Humanitarian Response Technologies. And I have to say, as we were talking about the work that you're driving around the globe, Annie, a lot of my work has centered on high wealth countries, and not even those countries, but the wealthiest people in those countries. And I was just truly inspired to hear the work that you've been driving throughout your career, Annie. So the organization, the research lab that she founded in Leeds, is hosted by the EPFL in Switzerland and also the Harvard School of Public Health. And they deploy and validate digital health solutions in global clinical studies. So if you really care about data, if you care about evidence, and you're looking to bring healthcare to new parts of the world, then please do have a look at Light. And then that brings us onto SAFIA. SAFIA is the reason I'm here today. Every time SAFIA phones me up to ask if I will come and support, I'm always very pleased to do so. SAFIA AGUENI is the president of Women in Tech Switzerland. She's also the co-founder of HealthSeed, which is a global venture building studio and focuses on scaling health ventures across markets. She specializes in connecting healthcare ecosystems, particularly across Europe and MENA, to accelerate the adoption of prevention-first solutions, which are clinically validated and trustworthy. And not an easy job. I appreciate as well, SAFIA, all the work you do with companies that are having something highly innovative in one country, but the patient need is somewhere else entirely, and you're really connecting the dots. And I think that's where, in all the years we've worked together, I see you're so good at connecting the dots. How can I help Group A help Group B and find an extra benefit for Group C? I really look forward to your insights today. And then that brings us to Dr. Anne Arts, who's joined us here. She is the head of the Novartis Foundation, and she leads the use of data and digital technologies and AI to transform global health from reactive care to preventative care. So you hear a theme as you go across our panel. She has a strong focus on health equity and women's health. She's also a medical doctor, in case we need one today. I would also say she chairs the Broadband Commission and the Working Group on Digital and AI Health, and serves on the US National Academies of Medicine Commission, which is on healthy longevity. And so really a fantastic panel that we have today. Our panel is going to go into women's health. So I hope that that is an important topic for everyone who's made the time to come. I know that this week at Davos, not everyone's thinking about what it is to live and thrive as a healthy society. But the fact that this room is packed, the fact that we have so many people standing in the back, that gives me confidence that the people who are also watching the streaming session, that we still understand that that's fundamental to our society growing. And there's so many business opportunities in that as well. So the first question that I want to bring to the panel, and SAFIA, I'd love to pick on you to start off with. So we know that in the field of artificial intelligence, that in 2025, only 30% of professionals are women. But we know that these AI predictions are changing every part of our life. How we receive healthcare, how we receive our financial ratings from a bank, all sorts of things about our life. What do you think that statistic means for us as end users of artificial intelligence when we only have that 30% representation? I'd love to hear what you've seen in your work with women in tech.
Thank you, Angeli. I have to say, I start with saying I feel like I'm really just in such with friendship setup, because these ladies are all fantastic, and being together in this panel, we know each other for some time with Anne and Angeli, just getting to know Lavanya and Annie. I bet many of you, lots of familiar faces. It's lovely to be back here. It's the 3rd edition for Women in Tech, partnering with Rupa's fantastic organization. So it's really a pleasure, and it really emotionally, I would say, I think you can hear the emotion behind. So it's a pleasure. Women in Tech organization exists for now 5 years, and it started from nothing. And seeing now the movement, the community of more than 12,000 people is really a big achievement, and nothing would be possible without the fantastic team behind. So kudos to really the fantastic team who made this possible. And and it's funny because I often hear like, oh, you have a great job, you lead Women in Tech Switzerland. But when people know that I do this on a pro bono basis, they're really shocked. So this is really passion. Passion really moves mountains, right? So the work we do at Women in Tech, first of all, is really having women understanding that they are already empowered and they have everything to really make a difference in society. Seeing those low percentage, and actually 30%, is not too bad, because back then, many years ago, I'm coming from tech industry, percentage was so low, ridiculously low, but it's still low today. Now, put this into the healthcare, which is the area I'm working in for many years. Imagine the impact. Health is really the priority number 1 for any human. Now, seeing women underrepresented there makes me worried. So I think for us, the movement in Women in Tech is not just gathering and connecting, it's great, but it's really equiping those women with whatever they need to make the impact. And that starts thinking, I have an innovation, I have a solution, I'd like to innovate there. I'm a woman founder. How can we support those women starting their business, right? Then how we upskill the women, because technology anyway is everywhere. So how can we grasp this technology and make a difference? And then let's face it, of course, capital. You have to fuel capital as well. And we know it's a challenge. So having all women empowered is one thing, but it's all then about impact. And that's what we strive really a lot in Women in Tech movement, is to really showing impact. And specifically on the healthcare, and back to the work we do now with HealthSeed, I'm so happy we started that now a few months ago with my co-founders. We came into the conclusion that the low percentage, again, about startups which are not scaling. They have great innovation, This is needed. There's definitely a market, right? Women's health, huge untapped market, huge unmet needs. And guess what? Big business. Because we're not here to do charity work. We are here to make business and make also those company profitable and VC profitable, right? So there's a lot of business around that, but there's also the huge impact. So really having supporting end-to-end those innovation to scale, to go into the market, to facilitate the path, regulatory path, clinical evidence, challenge the startup and the owner who's super passionate about their technology, but showing them reality, hey, you need to tap into market, you need to have some key opinion leaders. Just to name few of the challenge is what can make a difference. So being in a position as a co-founder of a venture studio to really make my own and humble part there is what drives me every day.
I love the work that you do in Women in Tech, educating women. And if you happen to have the opportunity to go look at them online, you'll see that there are many events throughout the year where you can connect, where you can learn new things. I also know, as well as supporting the women, there's the change that has to happen within the companies, within the corporations. And Lavanya, I know Sonova is taking this quite seriously. Could you tell us a little bit more about what Sonova's up to?
Yes, I can. Before that, I just want to put it out that there will be two hats I'm wearing. My first passion, behavioral science, and you might say, oh, that's nothing to do with women health. There is. And it'll come out because I'm very passionate about bringing behavioral science. And the second passion that I will take examples from, as you rightly pointed out, is Sonova. There's a lot of great work happening there, and I think this is a great opportunity to share. So before what Sonova is doing, I kind of want to piggyback on what you said, Safia, because you're right, the 30% is an important number. And there is a lot of research out there that shows that having women in decision-making levels, be it at the board or senior management, has a direct influence on higher quality decisions, which has a direct correlation with better business outcomes. So there is a business bottom line if the right women are brought in the right positions at the right time. So for businesses who are thinking of moving that needle, there is a very clear research-driven, data-backed reason of why it makes a lot of sense to have a more gender diverse senior leadership. And that is something that the organization at Sonova is seeing as well. Over the years, over the last couple of years, and this is the irony which I find across healthcare, and hearing care is no different. At the front line, the people who actually deliver care at the point of care, 70% are women and 30% are men. But as you go up that ladder of healthcare, that number starts dwindling. And by the time you reach board of directors or senior management, it can go as low as 10%. And that's something we see at Sonova as well. Our numbers are no different from the rest of healthcare. We are a 70-30 split at the front line. So in our points of care, our hearing care centers, 70% of the people delivering the actual care to our communities of people requiring hearing care are women, the ones who really have that daily interaction. And we are trying to move the needle on the top. So there are commitments, social commitments that have been made to move that needle both at the senior management and the board of directors level and at the middle management level. But now, quickly putting my behavioral science hat on, what I like about how they're doing it is they're doing it with intention. What has traditionally happened when there was this wave, we have these waves, right, of let's have diversity, is that we have quotas. And quotas have been shown not to work. But if you do it intentionally, and I think you can talk a lot about that, but what I mean by intentionally is there's a strategy behind it. You're bringing the right knowledge and right skill set to the table. It can actually have a very powerful impact, which is what I see Sonova doing today.
I'm really pleased to hear more and more companies standing up and taking this topic seriously. And I'm very confident they wouldn't do it if they hadn't calculated the business value. I wanted to go into the data and AI part of our work a little bit more. So we all work in an area where you're developing AI models, you're developing digital solutions, and then you're taking them out to patients. And we know that if that data was only trained on data collected in men's health, it's not going to be very accurate for women. And we see this huge unmet medical need for half of the population, for women. So the average woman spends 9 years of her life in poor health. And okay, you might try to think about which parts of her life are that. That's across the whole duration. That's just an average. But it's interesting when you compare it to the statistic for men, because it's 25% higher for women. There's just that longer period in pain, that longer period of suffering. Now, as we are developing now new interventions, new digital solutions, we have to think, how can we address that area where there's a bigger need, but also the areas where perhaps our businesses are already established. And Anne, I'd love to come to you now and hear the insights that you're seeing in your work in this space.
Thanks a lot, Angeli, and absolutely, I'm a big fan of creating the information and the right data so that we know what we are talking about when we talk women's health. And I mean with that women are systematically underrepresented in clinical research. So it goes by itself that the responses, the innovations, be it technology or scientific innovations, are more based on men's data than on women's data. So we as women leaders have a responsibility, I believe, to make sure that all data we collect in our work is separated for women and men, for per age, per origin, ethnicity, all of that, because it's so important in addressing the issue you are talking about. Let me take the example of cardiovascular disease. Cardiovascular disease is the #1 killer of women as well. So women have completely different symptoms than men with cardiovascular disease, and may present with a heart attack with very aspecific symptoms. You don't have the typical chest pain. You may have just a little fatigue or a bit of nausea. You are really having very different images if you have a woman in front of you with a heart attack than a man. And that makes that the diagnosis is very often delayed or wrong, and women get worse outcomes in general for cardiovascular disease. And I cannot stand that this keeps going on. We have to build the evidence that we understand what drives cardiovascular health in women, because we know it from our work on the ground with AI for Healthy Cities, where we brought together all the data from the health systems in New York City, Singapore, Helsinki, here in Switzerland, together with all the data from health influencing sectors, be it housing, security, education, income, transportation, food access, you name it. And we identified what are the key drivers for cardiovascular outcomes in populations. Well, women are much more sensitive to these key drivers. They are all linked to your socioeconomic situation, your education level. Social isolation is a very big issue. Single-parent families, which are in majority women parent families, are a huge risk factor, specifically in Europe and in the US, for cardiovascular disease. And we don't look at that when we are designing the interventions or the population health roadmaps to address that. So we have a responsibility to build that evidence that we know what we are doing. So, and that is what I have put as a mission for our organization. So we are currently building that kind of insights in our cardiovascular population health roadmaps in major cities. We are in 40 cities around the world, and we haven't focused specifically on women until now. That we have these specific insights, we will devise specific interventions to address the women's need in cardiovascular health. And let me end by saying this isn't a question of a solution for a product only. It requires a systemic change, and a systemic change cannot happen without the right partners. No one can do this alone. So we are building a strong coalition with several healthcare industry players like Bayer. Consumer Health is partnering with us. Yesterday we announced a partnership with Novo Nordisk, where we are bridging Cities for Better Health and Cardio for Cities, our flagship program at the Novartis Foundation, bringing together all these different partners with insurers, with investors, and with community-based organizations who will implement the change, that is the way forward. And that is how we see this at the foundation as well, both for innovations that are simple interventions and for very complex predictive analytics that drive simulations and predictors in the population.
I mean, I don't know how moved you feel. And I've worked most of my career in the pharmaceutical industry, and I can tell you what a huge step this is. I mean, to have Bayer Consumer Health coming together, to have Novo Nordisk coming together, to have this led on what is not just a new thing, but as you pointed out, building on the years of work that the Novartis Foundation has already laid. Now, Anne kindly sent me some thoughts and some material before we came to this panel, and so I knew she was very passionate about the opportunity in cardiovascular care. Now, I did something a little bit facetious. I asked ChatGPT what it thought the differences were between men and women in cardiovascular care, and it said, if you ask ChatGPT, you are 50% less likely to be recommended to go and seek medical support or help if you're a woman, or if you ask the question about a woman in the way that you phrase the question, than if you ask the same question about a man. So ChatGPT told on itself, said, I probably wouldn't recommend you got any help. Sorry about that. But this takes me then on to Annie, because Annie, I know you've been looking very carefully now as you serve low resource areas and taking inspiration from around the world about how the models are built that are making these recommendations.
Yeah, exactly. It's so important not just to think about the infrastructure, but about the actual tools and what data they represent. We've had a few percentages thrown around here, 30%, maybe it's 25%. How do we know? How do we actually know the representation of women in these tools? A lot of the latest AI models are commercial. They are black boxes, and we don't have enough information and scrutinizability of these models. We have to advocate actually for them to be fully open. And this is something that we've been doing in Switzerland here, and very proud to be part of the organizations that have pushed forward fully open models, such as an initiative called AERTS. It's Latin for open. And this is an initiative between ETH Zurich and EPFL here in Switzerland, where they're releasing not only the weights of the model, which is the numbers that represent the words. I mean, who cares? Like, how do you understand? How can you scrutinize that the word cat or woman is 0.2956, right? We want to know where the word for woman comes from. We want to understand how the models were trained, what information it was using. Was it using something that was biased? Is it only 20%? Is it 10%? We need to have an understanding of how the models are built so that we can control them and understand the problem so that we can actually respond to it. And this openness, this transparency, this is why this room is full. People want to know. It matters to us. And we really care about the way that these tools are representing us. And that's important. So I really resonate with all of the discussions that are going on so far. And I personally believe that a good panel ends in a fist fight, but it's really difficult to disagree, right? But I do have to represent also the academia side. I'll try to make sure that that's also represented, that not everything has to be a product, let's say, that is sold, right? Not everything has to have a return on investment in terms of money. And we need to start recognizing that a return on investment is also just a healthier society, and we can have public goods that are able to scale if we recognize this as an investment. There is nothing more valuable to healthcare than information. As a medical doctor, I know that I can have the most expensive drugs, the most expensive and fancy machines, but if I don't know when to use them, how to use them, or why, it is completely useless. Health is determined by information. And women and the communities, especially in the lower resource settings that we serve, women are pillars of these societies. And we know how to spread information, right? You know it. And if you want to be effective in how to spread this information, you better represent women. It's not about being equitable, it's about being effective. And if you have got healthy women, you have got a healthy society. And if you are targeting women and representing them in how you deliver these tools and include their voice, they're going to start using them. And they're going to start spreading the right information to the right people, and we're going to lift societies up through public good. We don't need to sell things to make sure that they are sustainable. We just need to make them effective.
So for those of you who've, I think so. Let's take a moment. So she hasn't got her fist fight yet, but that was. Lavanya, I think you wanted to add something.
I want to
Annie's
add something
comment.
to that. So first of all, the passion is like, like kicking me off the stage. We love the passion, but you know what you said? Like use that. Like we can talk. You know that's not a bad thing. Some of the trends are how we are wired as women is such a powerful thing. We tend to be more risk averse. We are biologically trained to be there. There is research out there. We can reference it later. But we look for risks. That makes us a very good person to have at the table, because when we're talking about AI and governance, to have someone who's able to think outside of the box, it's a powerful thing. We socially over time, yes, we were the ones who kind of, communicated, and there was a time that was very important. So there are these, as a woman, we do have certain, the way we are wired, which can actually be a core asset if you were to bring that to the table.
Thank you. So one thing that you mentioned really caught my attention, which was on the return of investment. And here, with the return on investment, I'll be completely transparent to this panel. It's one of the areas where I spend a lot of time. And it is, Annie, exactly as you say, it's because I hope for sustainability. I hope to be able to persuade my stakeholders that this is how we're going to find a sustainable solution. Some of you may see the talk that was given earlier here today, a panel which was from the financial team. And what I liked very much about that, and was actually maybe one of my takeaways that I'll bring to the health sector, was they talked about they sit in teams and banks and financial services, and they're always trying to create new products and new financial products that they can roll out to their customers. But actually, women are far less likely to invest. And so instead, they could just think about how do you take what's already there and make it meaningful and accessible to the women who would then be able to adopt those products. And it comes then to the healthcare sector, cardiovascular care, lots of very meaningful medical and medtech solutions on the market, not designed particularly for women, not always accessible, because if they don't have the opportunity to get the visits from the doctor in the first place, then they can't benefit from them. And so just saying, okay, you've put all of this research in, you're one of the big med tech or the big pharma companies that already exist. How can you now get more out of the investment that you've already made by looking at evidence for expansion to new parts of society? How can you look at the psychological aspect of that, the accessibility of will they take it, will they adopt it? I'd love to come on now onto a third question, which is really the differences we see around the world. So I know that many of you are operating in global roles and then thinking and having this unique perspective on the differences in global healthcare. Here I would start off with you, Anne, and be very interested to know, what are you seeing as you look around the world, as you look in different countries, with the opportunity for data health and women's health in particular?
Yes, the opportunities may be very different, or the responses may be very different, but I believe the drivers in women's health in general, across diseases, are quite similar. But the responses you drive have to be corresponding to the local priorities. For example, in Brazil, in our population health approach for improving or accelerating early detection of cardiovascular risk factors, we have installed screening corners in every health facility, because that's a very high traffic venue. There's like thousands of people a day who pass in such a health facility. And so there we screen everybody who passes, regardless the reason. And we found mainly women, because women come to the health facilities as a caregiver, as a parent, or as with their parents, they are much more likely to pass in the screening corner. We didn't identify any men. So then we had to do the opposite and say, where do we find the men? We have to go to the football stadia in Brazil, obviously. But in other countries, it is exactly the opposite. You don't identify the women early enough. And in cardiovascular health, early identification of your risk is the key to better outcomes, to a better longevity, healthier, and to avoid that you have an acute complication like a heart attack. So having specific tools and specific places where you can identify the people, the women who have a specific cardiovascular risk factor is absolutely key, and that is very different from New York City as it is in Helsinki, for example. Helsinki is using screening at the school gates because it's the single parent families are the highest risk. In New York, we are going to see how we can reach the minority groups, women groups in better places. In Singapore, we go to the mosques. You have to find people where they are and when they need it. So that is the future of health and care is going to be in your living room, in fact. 90% of the care we will access in a few years from now will be at home. So we have to start developing the tools that address the needs of people at home, and that are the women in general. They are definitely one part at home, but we have to design the tools around that life, not around the health facility anymore. And that is definitely something we should start and accelerate quickly because it's really urgently needed.
It's just a huge opportunity, and I love how local your examples are. It's really this city and this profile and fantastic work. So we can't ignore the fact that Annie is wearing the clothes she just bought on her trip in India. And so these are, I know that the work that you do in Light is really about low resource areas. And yet it's about AI solutions in these resource areas. And what are you seeing then compared to perhaps what I see here, bringing out new AI tools in the German-speaking Swiss hospitals? I'd love to understand.
Yeah, so first of all, I literally was sleeping in a plane in this, so that's it. But I think that there's a lot of similarities. This room is as packed, actually our room's even more packed in the lowest resource settings, where people are really, really feeling acutely their lack of representation. People want a voice in these tools. And we're representing some of the most vulnerable places, such as humanitarian response environments and others. And they recognize the importance to have their voice heard. And they want opportunities to do so. They come in large quantities to our, we have these events where we really are trying to formalize very actionably that exact kind of incorporation of their voice into the tools and allow them to co-design them with their own needs, their own language, and to represent their populations. We have an initiative called MOVE, which is MOOVE, so it's massive, and it has to be massive. These models are huge, right? And you can just imagine the dilution effect of you just putting your little nudge on this massive model that takes so much data that it's actually equivalent to every single unique book in the world. That's how much, literally 130 million books of text go into even the smallest models. How can your little nudge move these models? And that's what we're trying to do with MOVE, massive, open, online validation and evaluation, and to use evidence and nudges, but amplified, to make sure that we can shift the models to represent the places that need it most. And I think it's really important that we use the voice of people, and we don't expect them to understand AI. We don't expect them to understand, differential equations or whatever else. Everyone is their own expert on what they want for their own health. And they ask questions in the way that they understand their healthcare. I had a patient the other day who was 90 years old, and this was in South Africa, and she came to me and she said, "I'm pregnant." And I was like, okay, all right. Are you sure about this? Where are you getting this from? And she's like, I know I'm pregnant. I'm absolutely pregnant. And she was convinced about this. And then when I dug deeper, she told me, no, it's not like that kind of pregnancy. It's in my knee, right? And so she had a swollen knee, but the words that she is using to describe what she was feeling, that's what it meant to her. These are language models. We represent our health care in the way that we understand it. And we need to respect that. These are next word predictors. What is the next word? Most likely word, really. What is the next most likely word? What to do with pregnancy in knee? We need to respond to these kinds of questions. We need to understand how people understand their own healthcare and get their voice into the model so that we can give them meaningful responses, regardless of their background, education, or understanding of their own healthcare needs. And people want it. Yeah.
Thank you. Safia, I know that this is a topic where you've seen a lot, both in your work looking at personalised healthcare, which has been a long career of yours, and now in your today's work. How are you seeing healthcare across the world?
Thanks for asking, because I was like, oh, I want to react to that. I'm native from Africa. I've been observing Africa really evolving now. And I think I really hope we start to change a bit the narrative. You go there and you see what's happening, the opportunities, the creativity, innovation, best AI school. We had the AI summit recently in Rwanda. There is a lot happening, and as a country like Switzerland, we can learn a lot from that. That's the first thing. The second, the population, we know that. Talents, young generation. We're going to suffer a lot from that in Europe and other parts of the world. So saying like, okay, we go and represent this whole population, fine, but they are figuring out this now themselves. And there's a lot happening. And in the world of capital flowing, in directions here and there, we are trying to really drive more capital in Africa. And I'm sorry to say, but unfortunately, we can't still use the narrative of, go do this good, AI for good and everything, all great. But in reality, in the capital world, it's really difficult when you sit when founders are sitting in front of VC to get money, right? Yeah, okay, you can go and claim some grants and funding and Gates Foundation, just throw money on women's health, that's great. But we need to really also empower those people, say, you're going to do good and you're going to do business and you're going to build wealth. So I think this continent, observing now Africa and being there now and also seeing how we can really move the needle there, they are really figuring out. And I think there's a way, and back to what you said, Anne, earlier, partnership, collaboration. It's going to be really critical. Now, looking into Middle East, it's the same. We often hear, there's lots of capital there, but they're figuring out also themselves there how they can serve their local population. So bringing solutions from Switzerland and thinking, I'm going to go there because there's capital, it's a wrong thing. You have to figure out, you have to understand, do your homework, as you say, understand local population, make the case that you're bringing something unique and build it for the local population, then you might get a good here and they're going to listen to you. So that's what I've been observing in this particular market.
I wanted to take just one comment on that, because we have such an experience, fantastic experience with that. We run a health tech hub in Africa, the first health tech hub in Kigali. It was a Pan-African health tech hub with local entrepreneurs of building solutions for local problems. And we always made sure that at least half of the entrepreneurs housed in that health tech hub, this was in a Norsken house, were women entrepreneurs. And I cannot tell you how different the responses from investors when you have a woman or a man entrepreneur. Even if the ideas are equally valid and good, we brought them into connection with all the investors, but it is really difficult because the single thing that the investors first ask them, what is your exits? What have been your exits? And if you are a young entrepreneur, the innovation power in Africa is incredible. I do agree, we will learn from there, and even more so from China, by the way. But if you look at how difficult it is to attract that investment, we need to take another loop there. In the US, I just learned today that they are looking at exits across the different categories, because they have said women's health doesn't get any exit. No one is interested in investing, because the good solutions that have brought billions to the table in acquisition or investment were categorized under diagnostics or molecular diagnostics. They were not sitting under the special front of women's health. So we have to be very careful about all of that and help the women entrepreneurs specifically in low and middle income settings. We really need to support them. As all women here, we have to make that our mission, I believe.
And I'd just like to add on that, because I want to make sure that people don't conflate global good and public good with me being a hippie. All right, I'm really, you know what I mean? I don't mean, but what I'm saying is, it's not one or the other, and I think that's really important. People need to understand that there is a place for public good in the whole process of empowering people, including through capital investments. There's a place for neutrality, for real evidence that can be trusted. We need an unbiased space as well to understand that if any of these tools that are being created by startups, are they actually impactful? Says who? Based on what? Exactly. And so what we are doing with our MOVE initiative, as well as others, is just building that space, that academic neutral space, where anyone, we don't care which startup it is or which company it is, it could be OpenAI, it could be anyone. We just want to make sure that we're moving away from this kind of AI evangelism, where everyone and their granny is coming with a startup, right? Going, we're the best. And governments are getting overwhelmed by this noise. And it's fragmenting the space, and we're not feeling the power of our majority, actually, because everyone is fragmenting. And if we can just find a space where they are held accountable to their claims of impact, people will start learning from it as a community, and all the models will get better. And this kind of continuous learning through neutral feedback is something we have to invest in. And global good and public good tools and initiatives are part of the success of a return on investment. They're essential, as you said before. Like, a lot of things just aren't profitable. I haven't heard of any company or startup going to a war zone and going, woo, money to be made here, right? That's wrong, actually, to do that. And there's space for humanitarian response, and it needs to be represented. And so I just think that it's important that we actually invest in public good as a startup, because without that runway to show people how valuable it can be, no one will invest in it. And there's a gap, and that gap needs to be invested in as part of a startup or company's journey.
Yeah, and I think many of us in health have seen that time and time again. We're building on, for instance, data infrastructures. We're building on networks. We're building, I think, on benchmarking, as you highlight, that has been driven by NGOs before us. We're slowly coming to the end of our panel. And so I wondered if each of my 4 panelists could, in a concise sentence, otherwise we'll get that fist fight, which is them kicking us off stage, tell us what they're optimistic about. We've talked about some heavy numbers here, but what are you optimistic about? In Lavanya, I'd love to hear.
I can go first. I'm optimistic after hearing a lot of your conversations, because at the end of the day, a lot of what you're doing is coming from you. And what I keep reminding my team as well is, at the end of the day, AI or not, there is always a human at the receiving or the providing end. And as a human, you have the ability to influence. So that's my behavioral science hat on. As my hearing care hat on, March 3rd is World Hearing Day. So take your women hearing care in your hand and go get your hearing tested, because it's never too early or never too late to do that.
March 3rd, everyone.
March 3rd.
Annie, what are you feeling optimistic about right now?
I love that people are seeking evidence. The hype is receding, and people are saying, show me that it works. And there's nothing more powerful than evidence. And we can learn from it. And we must remember that AI was machine learning. And it can be continuously learning. And if we are demanding evidence, we can continually improve tools to make them better suited to our own needs. Yeah.
Fully agree. And
Well, I'm optimistic person, so easy for me to answer there. Even though we have still a long way to go, lots of challenges in the world these days. I would say I'm optimistic for to build on Lavanya's words. The people, we are the ones who make really a difference as people in this world of technology. And as Women in Tech movement, it's all about people, it's about advocacy, and it's about partnering and joining forces. So continuing building on that and take an action really as a takeaway from here. Think as a founder, as a corporate executive, as an entrepreneur, as a VC, whatever role you have, executive in your role, think of what you can do really to continue making the impact that we want to have in this society and move the needle when it comes to women's health and beyond in the health innovation, because we have technology to do that, but it's really going to be back to us as human, what we do about that.
I really think so. So you're getting some to-dos from SAFIA there. And then, Anne, I'll quickly tell you what I'm optimistic about. That collaboration you mentioned, because I know from having worked in the pharma industry that what it means to bring these giants together. So, but I'd love to hear now, what are you optimistic about to close out our panel?
Thank you, Angeli. I'm very optimistic to bring it back to the title of the panel, that we currently we have the science, we have the data, we have the technology to now make this urgent transformation of our health systems from being these reactive care systems waiting for people to get sick before they look at them, to become proactive, find people with a risk factor or with an early disease as soon as possible, to become predictive. We have the predictive analytics and the tools now to be able to predict disease. And then we can become preventive so that we create true health systems that keep people healthy. And I'm very optimistic we are close to getting there.
Thank you. Please thank my panel. So I think that there is a short break. I'm making eye contact. Yes, I think you get to enjoy a short break. We're here if you'd like to talk to us. Thank you.